MonaLisa Touch is a fractional CO2 laser that allows your body to use its own innate healing to rejuvenate vaginal tissue. It leads to vaginal revitalization and rejuvenation. It's not a surgery. It's painless. It's done as an outpatient in my office, and there's no need for any anesthesia, although we may use a little bit of topical lidocaine. A probe is placed into the vagina, and a handpiece is used on the vulva. And through the transfer of light and the generation of heat, new tissue is formed. New collagen, elastic, and blood vessels. Now, this new generation of tissue essentially bypasses the need for any type of topical preparation, such as moisturizers or vaginal estrogen. There's the return of that thick tissue, those rugal folds, increase in secretions, so it decreases pain with intercourse, vaginal infections, vaginal dryness, urinary tract infections, and overactive bladder. Essentially, the vagina is returned to when you're 18 or a premenopausal state. Remember, we also treat the outside of the vagina, and that's really to help with that sandpaper fill that many women experience with the initial penetration with intercourse. Also, we treat the clitoris and the clitoral hood. I have many patients tell me that their libido's improved and that they now have orgasms. The MonaLisa Touch has been found to increase or improve sexual function, receptivity, and initiation. It's a 5-minute procedure. There are 3 treatments, 4 to 6 weeks apart, and then 1 annual maintenance therapy. People have told me it is life-changing. And the next slide shows tissue of what the vaginal tissue, what it looks like after you've had a MonaLisa treatment. And those little white areas are just the little ablative regions. Again, this is the same patient. The first slide here, you can see that there are no rugal folds. It's completely flat. There's no secretions. The area that's circled is petechiae, and that's actually trauma. But again, they took this next slide is that same patient. Increase in those rugal folds, lots and lots of secretions. So I'm going to take you back to histology. First slide, really low estrogen, no connective tissue or blood vessels. Second slide, really thick epithelium, lots of collagen, blood vessels, and elastic tissue. So the only downtime is about 3 to 5 days, and about 10% of the women experience a little bit of vaginal discharge or some mild spotting. There are only a few women who can't have this treatment. So if you have an active infection, like herpes, now we can treat you if you have herpes. We just need to give you medication so it suppresses it, so you don't actually have an active lesion when you come in for your treatment. Someone who has a lesion on the outside of the vagina, again, that's the vulva, inside the vagina or on the cervix, that hasn't been evaluated. If you're pregnant or 3 months postpartum, but I have treated women who have using prolonged breastfeeding because that's a low estrogen state and it's worked really well. Women who have pelvic relaxation where it's actually coming down or out the vagina, but again, women with moderate to mild pelvic prolapse, phenomenal results. If you have had a surgery with mesh, we try to avoid using it. Now you can have had a bladder lift, but if you've had a surgery with extensive mesh with an anterior or posterior, just parts of the vagina repair, we kind of want to avoid it. And then if you've had any radiation to your pelvis or your colon, and women then who have issues with overactive healing called keloids or poor wound healing. The next study in the next slide isn't really new anymore. It's from 2016, but it's a pilot study. And what a pilot study does is it looks to see if this technology is effective and should more money be placed and looked at further research. And they did find that indeed it was. They used 30 women and they had a 92% satisfaction. There is nothing that I do in medicine that has that high of a satisfaction rate. They noticed improvement in all of the symptoms that they looked at 3 months, and that improvement was maintained at 12 months. There was a decrease in vaginal dryness, pain with intercourse, and improved sexual function. Again, no adverse effects, but about 10% of those women had some vaginal discharge and spotting, and they could not even use lubricants when they had intercourse. So that's the good news. The not so good news is it's not covered by insurance. Currently at my practice, it costs $2,100 for 3 treatments, and then you want an annual maintenance therapy for $700.